Get me the AED.
Okay.
Please help.
The next step in the ABCDs is B, breathing. Rescuers often spend too much time checking for breathing. Take at least 5 but no more than 10 seconds to check for adequate breathing. Look for a regular rise and fall of the chest. An adult patient who exhibits occasional gasping or irregular breaths, known as agonal respirations, is not breathing adequately. Treat them the same as someone who is not breathing at all. Maintain an open airway with your ear next to the person's mouth. Look for chest rise, listen for sounds of breathing, and feel with your cheek and ear for airflow or warmth. Take 5 to 10 seconds to check for breathing. If the victim is not breathing adequately, use a CPR barrier and give 2 rescue breaths for 1 second each. Provide just enough air to make the chest rise. Rescue breaths that are too forceful or too large can cause gastric distension and vomiting. If the chest won't rise with your rescue breath, reposition the head and try again. If a rescuer does not have a CPR barrier, perform mouth-to-mouth rescue breathing for an adult or child. Open the airway, pinch the nose, seal the victim's mouth with yours, and give breaths. For an infant, perform mouth-to-mouth and nose rescue breathing. Open the airway, cover the infant's mouth and nose with your mouth, and give breaths. As professional rescuers and healthcare providers, OSHA requires that you use a CPR barrier or bag mask to deliver rescue breaths. Rescue breathing alone, without chest compressions, is used for patients who have a definite pulse but are not breathing adequately or at all. Early and effective rescue breathing, especially in children, may prevent the onset of cardiac arrest. Use the correct rate for rescue breathing. For adults, provide 1 breath every 5 to 6 seconds, or 10 to 12 breaths per minute. Children and infants will require a faster rate. Provide 1 breath every 3 to 5 seconds, or 12 to 20 breaths per minute. A common complication of rescue breathing is vomiting. Air may enter the stomach due to improper airway positioning or rescue breaths that are too forceful or large. It's important to open the airway properly and give just enough air for chest rise. You can also use cricoid pressure to reduce the vomiting associated with rescue breathing. Pressing on the cricoid cartilage closes off the esophagus and helps force air into the lungs and away from the stomach. This reduces the incidence of vomiting. Use a trained rescuer with no other resuscitation duties. To locate the cricoid cartilage, slide your index finger to the base of the patient's thyroid cartilage, or Adam's apple, and feel for the large horizontal ring. Using the tips of your thumb and index finger, apply firm, backward pressure to the cricoid cartilage. Avoid excessive pressure because it can damage the trachea. Now it's your turn to practice. Use a mannequin to practice assessing responsiveness, opening the airway, checking for breathing, giving rescue breaths, and applying cricoid pressure.